One of the questions that comes up frequently, is it ever too early to start rehabilitation? Is there a right time to start rehabilitation? Should I wait? Will it hurt the patient if we start too early? And this has actually been looked at in the medical literature. And for all practical purposes, you can't start too early. There's some literature to suggest maybe the first couple days are too early, but most patients are too sick anyway to do much. But we definitely want to start rehabilitation in the intensive care unit. And it's important for acute care hospitals to realize this and have physical therapy, occupational therapy, and speech therapy, seeing the patient actually in the ICU. Very progressive hospitals will walk patients on a ventilator, patients that are hooked up. So what can you actually do in an intensive care unit? You'll frequently see simple things like range of motion exercises just to make sure patients don't get spasticity. We definitely want speech therapy involved, and that can be difficult to do in an acute care setting. But we want to do that cognitive eval. We want to know, is Mr. Smith different than he was before? And do we need to worry about that? Frequently, we're just evaluating speech and swallowing. Are they safe to start eating? But we ought to pay attention to cognition. Get patients out of bed, stand them, walk them in the ICU. As I said, we walk patients on a ventilator. I had a personal experience with my wife being in an ICU for a prolonged period of time, being very sick, and as she was getting better, the intensivist was incredible, and he believed strongly in going outside. So we actually went outside one-on-one with a nurse and a physical therapist to a garden and the sun, and it really was therapeutic if you think about how long you're in the hospital. So there's a lot you can do, and the sooner the better. Patients who start early have better outcomes, are going to reach a higher functional level, and if we think about it, then the rehabilitation hospital, we've sort of had a jump start. We had that advantage. We can sort of pick up right where they left off and get those better outcomes. Now, it all sounds ideal, doesn't it? But there's barriers, and the barriers are going to be cost, staff, and machines. But you know, it's really for better patient outcomes, and we ought to encourage it.